You also are one of the few that treat pediatric patients.
Yes.
And what can you share with that? We have a lot of families that are going through this with autism, epilepsy, cancer.
Yes. I would say, yes, I'm boarded in pediatrics actually.
Yeah.
So I'm very comfortable with treating children.
Yeah.
And I've had I would say most of my pediatric practice is for seizure disorders.
Okay.
Most of them are either Lennox-Gastaut or Dravet syndrome, which are multiple seizures during the day. But I have some that have other seizure disorders that have different types of seizures, and we're trying some CBD with them. The next biggest group are the autistic patients, and those are from youngsters up to young adults. And I find that CBD has been very effective in helping these kids with anxiety. A lot of their aggressive behavior is anxiety driven. Also, the area of the brain that controls anxiety is very close to the area that controls aggression. So we're seeing a lot of improvement in behaviors with using CBD. And if they don't do well with CBD, I'll go to something like the acid form of THC, which is THCA. It's not intoxicating. And then some I'll microdose with THC, and it'll help with their anxiety, their behavior, their sleep. A lot of these kids have terrible sleep problems. It's hard for them to fall asleep. They wake up often. So I've been really pleased with the results of using cannabinoids. I have patients who have chronic pain. I have pediatric patients with things like psoriatic arthritis or juvenile rheumatoid arthritis, Ehlers-Danlos syndrome, which is a connective tissue disorder, mitochondrial disorders where nobody really knows what's going on, and sometimes we use some cannabis to see if we can help them with that. And I really have not had any issues. The other group of pediatric patients that I see, and I do get referrals from some of the specialists, are the kids with Crohn's disease and ulcerative colitis. Cannabis.
Are you seeing more cases of Crohn's and ulcerative colitis just in the last 5-10 years?
Well, see, I was kind of out of it for a while. I wasn't. And I wasn't really focused on those types of illnesses. When I was practicing, I was doing more attention deficit, behavioral, and school problems. And so I can't say that I have to say I'm seeing more inflammatory bowel because now as a consultant, I see more of all of these things that I saw very little of when I was practicing general pediatrics.
So with the CBD bandwagon that everyone's jumping on right now, a lot of people are afraid of THC. We get a lot of people saying, can you refer us to a doctor who will not recommend the psychoactive portion of cannabis? We would like the non-psychoactive portion. You know, we both know the entourage effect. Can you share that THC is needed in a lot of cases and it's not bad? Can you give your thoughts on that?
They say cannabis heals and it poisons.
Okay.
And this is very true because THC at low to moderate doses can be very effective in helping a lot of problems. When you get up into the higher doses, sometimes you can run into some adverse effects. And typically CBD and THC work better together than either one of them by themselves. And if you have enough CBD on board, CBD really keeps THC from causing a lot of the psychotropic or intoxicating effects. So most of my patients end up on some sort of CBD-THC ratio based on the problem. So if it's even if it's a 20 to 1 or a 15 to 1, there's still some THC in there. And those patients, let's say with seizure disorder, with psychosis or schizophrenia, psychoaffective disorder, patients with, anxiety, psychoaffective psychosis, seizures, those types of patients I'd usually recommend the higher CBD ratios. Patients who are trying to lose weight, because weight loss helps with reducing pain.
Okay.
Sometimes I'll get them started on a higher CBD ratio and then gradually increase the THC as needed for something like pain. But most of the seizure patients and the anxiety patients do very well with high CBD unless they have depression. If they have depression, then I increase the THC so that they're more in maybe a 5 to 10 to 1 ratio. But I can't remember ever recommending CBD